Back on the town hall with a question that was texted to us by Kendra and Elma. She asked, if you test positive on an at-home or rapid test and then negative on a PCR test, do you have a COVID infection or not? It's a great question with so many people now using these at-home test kits. I got an answer from Dr. Thomas Russo, Chief of Infectious Diseases at UB's Medical School. So Dr. Russo, it sounds like simple question, but maybe not necessarily a simple answer.
All tests have the potential to have false positives or false negatives. And it's important to always interpret a test in the context of the likelihood of disease. So let's take the viewer's question. This individual had a positive rapid antigen home test and a negative PCR. We're always concerned about false positives in the setting when there's a low likelihood of disease. So if this individual was asymptomatic and had no recent high-risk exposures, but then did a rapid antigen test at home was positive and a PCR test that's negative, it's likely the rapid antigen test, since the likelihood of disease is low, is a false positive. However, conversely, if that individual was symptomatic or had some high-risk exposure, say someone in the household was infected, they went ahead and did a rapid antigen test and it was positive, and a subsequent PCR test was negative, I think it's safer to assume that you likely have COVID. There's a variety of reasons that PCR test might have been negative, and then go ahead and take the appropriate actions in terms of reaching out to your healthcare provider for your own personal health needs and protect those individuals around you by isolating.
Dr. Russo said, put simply, if you have symptoms and any test shows positive, you should assume that you caught the virus. There is so much community spread right now. And he said as a result of that, if you test positive with one of those at-home kits, you don't even really need to get a PCR test to confirm that right now, because in all likelihood, you have COVID at that point. On the flip side, if you have an at-home test that shows negative, just one of them, you should do at least one more about 24 hours later to just confirm that result.